I am Mike Masharia. I am a serial entrepreneur, having started a career in entrepreneurship 20 years ago. I'm right now 45 years old and still have a lot of energy left to build the next Africa digital healthcare unicorn. My experience around healthcare as a founder of Ponea, one of the founders of Ponea, was around my experience around integrating complex technology systems and bring in what we call transformation projects to public sector and private sector that had significant impact to citizens and the population at large. My latest venture, which is Ponea Healthcare, which is really a global, an emerging global startup based in Africa, is really around transforming healthcare using the technology platforms. I have significant experience in doing this and also put together a very, very formidable team, both at an advisory, investor, and also at a team level to help me achieve this objective. Ponea Healthcare. Ponea Healthcare is a healthcare aggregator delivering services by using IT technology platforms and then enabling and connecting vetted, accredited service providers in the healthcare space. The origin of the Ponea word comes from a Swahili name, saved by a whisker, or a proverbial phrase, dodge a bullet, a word we use a lot to describe relief after avoiding an otherwise precarious event. And I think that's how emerging markets we look at healthcare. We look at healthcare as situation, really, we only seek healthcare when we are bombarded or have a situation to address. We never look at healthcare from a preventative point of view. Ponea seeks to come in and sort of help patients and help transform this conversation, to help bring that level of changing our habits as we seek healthcare. And as we do that, our purpose remains to also help drive entrepreneurial energy across the healthcare ecosystem. Today, when you look at healthcare in Africa or emerging markets, healthcare is left for large faith-based organizations, either left for private PE funds, private equity to make investments, or one of those lone entrepreneurs that jumps in on non-NGOs that then end up building large hospitals, or eventually left to government. We believe that healthcare, to be able to expand access to the kind of ratios we need between patient and doctor access, there's need to relook at the whole healthcare entrepreneurship journey to allow younger doctors with much less tools or investment to be able to come on board using technology to be able to be closer to the patient. We also believe that trust among service providers should eventually move away from WhatsApp groups or show me who the next doctor you have or the best doctor you have on your network, to where we use data to rate service providers, and where the supply and demand, whether it's patient and service providers, can eventually rely on data-driven trust computations, where you rate a doctor, you rate a facility, you rate a provider, and the doctor also rates you, such that eventually, when it used to take me 1 hour to prepare to call a cab to come to me, today I call a cab when I'm walking down my stairs. It has really changed. If you think about what Uber and the rest of the companies have done, rail-heading companies, they've changed the way we really think about about transport. In transport today, you really don't even think anymore about when to hail a cab. You don't think about, I need to call my Uber driver 1 hour before, you call him on demand. So we also think that healthcare at some point, to be able to change healthcare habits, the whole generation of demand in healthcare and how you look for healthcare when you need it, will change the way we interact and how our habits in healthcare, our habits in pursuit of healthcare interventions. Around our business and Ponea is really across the fragmentation nature of all our healthcare providers. As a patient, you go to one facility, you go see a doctor, and the doctor retains your records. You go to the next facility, and they request you to do they also request for your records, or alternatively, they also request you to do a second X-ray if you've done the first X-ray in a different facility if you're coming from different locations. That fragmentation nature just sort of creates chaos and increases cost for the patient. We also then, because of the complexity of getting healthcare, we then tend to not want to seek healthcare until we're really sick. So eventually what happens, our habits are we go to pharmacies and we have over-the-counter prescription. That is how we seek healthcare. So really, if you think about it, the pharmacists in some of the drug dispensing companies have become really the primary caregivers to many of us in emerging markets. Why? We avoid seeking health because we find it inefficient, we find it extremely inconveniencing, we find we cannot trust the service providers sometimes that are given to us, right? And the discretion nature of healthcare in emerging markets requires that when I come to you, I know that you're going to be discreet with my information, and that in case I want to seek certain interventions in my healthcare, I'm not scared or worried that that information is going to propagate to unintended people. The way to do this, we believe technology, especially now, enables interconnectivity between all these players, integrating, bringing capabilities like AI or bringing capabilities like technology, mobile apps, or even in the back end, removing complexity in complexity in the back office systems of hospitals and providing them traffic flow in a more seamless manner, such that when I go to a hospital, it can be predictable. I can have predictability in terms of my waiting time. I can be able to know which doctor I'm going to see in terms of rating and how they're going to attend to me. I can be able to give feedback. In case I don't like them, I can be able to make a decision if I'm going to go to the next person for referral. And also, we also need to allow price discovery, allowing us to have multiple options and before we make an intervention. For instance, around a square mile, you're then able to make a decision which provider I can go to based on cost, based on traffic, based on reputation, and based on my time and my availability. We feel that eventually we need to bring value to the patient. And the patient, we need to bring transformation nature in such that the patient eventually feel that they're at the center of their lives in terms of healthcare intervention. In terms of impact, we believe that finally the patient can take control of their healthcare, such that they could change their way of interact with healthcare. They don't have to feel that it's such a big challenge to go seek healthcare and eventually detest from or even stop going directly desist from going directly into the pharmacies to get services, but eventually are able to then seek telemedicine or teleconsult to doctors to try and get services. We also believe from a price discovery point of view, the patient is going to get best value in terms of ensuring they're using the best possible way using technology to determine where to get care at the best price possible. We also believe that trust among service providers is going to be highly enhanced by enabling both providers who deliver very good services to be able to be amplified on the platform, not because of necessarily many years of experience, but rather because the service they offer differentiates them, and they could decide if they're going to increase price, or they could decide to retain price at a lower price based on patient volumes, but not because you've invested in significant infrastructure and you have to transfer that cost to the patient. Finally, as we close and we talk about the big idea about Ponea and what are the take homes, is really the first conversation is how do we drive change within health seeking behaviors for patients? The second thing is how do you democratize healthcare in emerging markets? The third is how do we drive entrepreneurship in this significant ecosystem that requires more entrepreneurs to take a position, younger doctors to want to launch their own practices, younger lab technicians to want to launch their lab centers, radiographers and radiologists to want to launch diagnostic and imaging centers, pharmacists to want to launch more well-professional pharmacies, and eventually other people, entrepreneurs, to launch hospitals. And as we do that, as we increase that entrepreneurial ecosystem, we then are definitely driving the issue, what we call technology at the heart of it allows mobility, allows efficiency, allows cost cost structures to lower cost in terms of delivering this service to the patient. And finally, how do we then connect all these fragmented ecosystems to look at one-stop healthcare? So as we scale in other markets, in emerging markets, whether it is Nigeria, South Africa, Morocco, Egypt, these are markets that we seek, that we need to scale to. And as we look at Kenya as one of our launch markets, as we then move from Kenya into other markets, we think and we believe that those markets allow us to be able to replicate some of our understandings. And for the way we look at our business as a Rubik's Cube is that for every market, it's not a one-fit-all kind of approach, but for every market, we look at new ways in which to scale, whether it is enabling areas like fintech, embedded services, where we allow micro-lending that is embedded in our healthcare offerings, whether it is microinsurance from an outpatient point of view, or enabling SMEs, bringing a whole new product for SMEs in any market we go to be able to offer services to their employees. And that, I believe, is our value proposition at Ponea Health. Thank you.